Hi, I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon from Louisville, Kentucky. Are you working at home right now and starting to have some numbness and tingling involving your hands, maybe getting some neck pain or back pain? These are some simple things you can do at home to help with those symptoms. Because you're at home and you're not at your ergonomic desk at work, you might be experiencing some numbness and tingling involving your thumb, index, and middle finger. And that can be early onset carpal tunnel syndrome. It can happen to one hand or both hands. It's typically related to overuse, and it can also be based on the position of how you're sitting or even your keyboard position. So the first thing we recommend is you start doing some carpal tunnel stretches if you're getting thumb, index, and middle finger numbness and tingling. I have posted a video on my YouTube channel, so if you just Google Grossfeld carpal tunnel stretches and YouTube, that will pop up my video, or you can go to my website at louisvillebones.com and then just hit the YouTube icon and it will take you to that video. So the carpal tunnel stretches should be done 2 or 3 times a day if you're experiencing those symptoms. The second thing I recommend is just purchase a wrist brace, and you can actually purchase that at any grocery store in their supplement or vitamin department. So just a wrist brace to wear at night to help preventing your wrist from doing this position, which can put more compression on your median nerve, which is the nerve that causes carpal tunnel syndrome. The third thing I'd recommend is your keyboard position. If you're starting to get this numbness and tingling, get your keyboard closer down into this position as opposed to up here, because that can put more strain on your carpal tunnel. So bring your keyboard position down, which might mean if you don't have a keyboard tray that's adjustable at home, lower your chair so your hands are lower so you can reach the keyboard easier. The next potential problem that we hear from people that work at home is they get neck pain. And neck pain a lot of times is, again, positional. So it can also be from the fact that you're maybe using your cell phone to talk as opposed to a landline type phone at home. So we really recommend go ahead and plug in your headphones or your earbuds into your phone, and that way you can move your head during those long conference calls. The other thing is switch the sides switch which ear you're listening to your phone. So if you're constantly like this, switch over to this side. That way you're allowing the right side to less while you're using the left side and vice versa. That can help. Also, again, keyboard height. So if you're like all day and you're like this, you might need to change the height of your keyboard or even change the height of your laptop or screen, so that you're not putting strain on that neck. And you'll just have to kind of play around with it, because typically at a workstation at work, you've already worked out all these bugs, and your employer may have supplied you with an ergonomic chair or an ergonomic desk, which you just don't have at home. You might be sitting at your kitchen table trying to do these long hours of work on the computer or doing conference calls. The third problem is low back pain, which is really common because you might be sitting on your dining room chair, which is really not meant to sit on for 8 hours. So put a pillow or wrap up a towel, roll it into a roll, and just place it in the lumbar region of your low back, and then just sit that against the back of your chair when you're sitting in your dining room chair. The other thing that really helps to reduce the force on your low back is if you can put a small stool, and that way you can get your foot elevated when you're sitting. If you don't have a stool, put a stack of books or something, get creative so that your feet are elevated. That decreases the force on the low back area. And another thing is get up and walk and stretch, and try to do that if you can once an hour, once every couple hours, just to get your blood circulating. You can reduce the tension where you're sitting there with your neck and your back and your wrists, and those things will help. Thank you.